Hey YouTube, Mindy and Mandy here.
Hello.
That's Mandy. She's got the Prego belly. Woo woo! 10 weeks, guys. We're gonna meet the little miss. Super excited about that. We are headed to Dr. Portella's office. Dr. Portella and Dr. Harris are with Valley Dermatology here in the Boise area. So we're gonna get some fun stuff done today. We can't wait to show you guys and tell you all about it.
Welcome back.
Thank you so much.
Yeah.
So just to recap from before, we were here about 6 months ago and we got Botox done. You did a great job, so thank you.
Good.
Loved it, loved it.
How long do things last for you?
I mean, it's still there. I still don't, I mean, looking at pictures before where it was like we were super crinkled in the forehead, I think even just to try now, it's like not nearly as
good.
So Mandy's, Mandy's pregnant, I'm not, so I was hoping to get something a little more abrasive.
Yeah.
I do have some acne scars right here, mainly just from those good old high school days.
Yeah.
What would you suggest for that?
We find that microneedling works really well for acne scars, and we can control how aggressive we want to be by how deep we set the needles to go in the skin. And the device that we use is called Procell. It's the manufacturer. It's got 20 different small needles on the tip of the device, and we run those over the skin, and they cause micro injuries. And what that does is it stimulates the stem cells in the skin to release something called cytokines and growth factors that stimulate collagen to grow. And it helps to stimulate healthy collagen and not scar-like collagen, because we've all seen scars that look really bad. And so as we cause micro trauma and we get a release of growth factors, we complement that with growth factor serums that we pair with your microneedling treatment. And together those can help to fill in those acne scars. They can help with texture, tone, and sometimes even pigmentation problems.
Yeah, oh nice. How many do you suggest?
For most patients, we encourage at least 3 treatments, and we can get more aggressive over time.
Okay.
But as we get more treatments, the body's going to respond better each time and see incremental improvement. A competitor to microneedling are going to be things like resurfacing lasers, and they certainly work really well, and we recommend them frequently also. But microneedling is much more cost effective for most patients.
And how much time in between each treatment?
We recommend at least a month between each treatment so that your body has time to fully heal from the injury that was done before, because it is a targeted injury to the skin.
Okay, well I'm interested in that.
Let's do it.
Okay, thank you.
Yeah, you bet. I'll get everything ready.
Let's do it.
All right, Mindy, what are we doing over here?
So I'm gonna wash my face, take all my makeup off, and then we are going to use some lidocaine for some pain, because I'm gonna get some deep abrasion done, which is gonna be awesome. Can't wait.
Awesome.
Alright, so this is topical anesthetic. This is lidocaine, and it's going to be really cold, but we want to rub that into the skin and kind of deaden those superficial nerve endings. And what that is going to do is just make your microneedling treatment a lot more tolerable. So your forehead tends to hurt a little more.
Yes.
Now, Mindy, before we met, Dr. Portella, I know you mentioned you've had this done before. Yeah. What was your experience, Mindy, with it?
It hurts so bad, but it helped.
Did you do numbing before?
Yes, we did. Yep, I remember. But I'm a no pain, no gain, girl. It's like just what you need to do.
Beauty is pain.
That's right. So I had some friends that asked how it was, and I was completely honest with them. It hurts so bad, but it's so worth it.
Did you find that it helped with your pores a lot?
Yeah, I did.
And how many treatments did you have done?
I've just had one so far.
Okay.
So this will be my second.
So we've got some of that rubbed in, and we're going to let some more sit on top of the skin. And it's going to take about 30 minutes to really kick in to the point we want to. Your skin's going to feel a little bit more cool as it starts to lose feeling.
Okay.
But now we start the clock.
Okay. Hi.
Here we go.
Here we go with the pregnant lady.
So I'm just doing, obviously, So I'm just going to do a very light chemical peel, nothing too fancy, but just to help clear up.
For a lot of patients, we do chemical peels, and the Perfect Derma Peel is kind of our premier peel that goes several layers of the skin deep. It has a really good effect on lentigos, which are sunspots. It can help with pore size and acne problems. But this is not one that I generally would recommend for individuals who are expecting. And so that's something that we can look at for you in the future.
Okay, perfect.
Just for our acne patients primarily and our patients who aren't expecting, we've kind of formulated a proprietary peel using glycolic acid, trichloroacetic acid, and zinc. And the zinc is anti-inflammatory, and it just helps to lightly exfoliate the skin. It's going to open up those pores. It's going to help with that glow and just improve acne in general. And for some of our pregnant patients, they'll be able to do this every 2 weeks throughout their pregnancy, and that can help significantly with acne without exposing the baby to any harmful chemicals that could get inside the body.
Okay, perfect.
What we're going to do is just kind of rub it on the face using gauze, and we're going to leave it on for about 60 seconds before you rinse it off, just right back here in the sink.
Perfect.
Okay, I'm pretty numb, you guys. It's kind of hard to even talk with my tongue. But
How long has it been?
30 minutes.
Okay.
I feel really numb. I'm going to go ahead and wipe this off.
You look like you just got some dental work done. Your lips don't move like these.
How are you feeling? We'll get this wiped off and get started here.
Okay, so we're going to get really close to you guys.
Right up here.
Because we will be showing an after.
This is what I'm mainly going for right here. Just
And
those
I've known
acne
Mindy my
scars.
whole life.
How have you?
And just from the last time she had this done, before we knew Dr. Portella, it has improved so much. So
We're going to get them. We're going to zap them.
I'm kind of FOMO right now, just so you know.
About 11 weeks you can come.
All right.
All right, as we do the treatment, we're going to use the growth factor serum from the company Portella, and this is going to be the gliding agent. It's going to help the treatment tip to move across the face. And one unique thing about the Portella system is that we don't glide it across the face, which can cause scratches and superficial tears. But it's more of a stamping mechanism, so we don't create the wrong types of injury in the skin. And then this helps to promote the body's release of natural growth factors and cytokines. Following the treatment, you're going to be given this little kit to take home. And this is about a week of serums that you can use. And you're going to have step 1 and step 2. And so starting tomorrow morning, you're going to take and just do a pump of step 1, and you're going to cover your face. And then a pump of step 2, and then you'll cover your face once more. And so this is the cellular renewal serum, and followed by the healing accelerator serum. So it's, continuing to stimulate your body's natural healing response to improve the appearance of the scars and the pore size, and to help that happen a little bit faster. And so we send those home with every one of our patients. We don't make them pay extra for those, so it's just kind of an added benefit.
Nice.
I'm going to lean you back, and we're going to do a final clean on the skin, and we'll get going.
Let's do this.
This is the treatment device. So you can see tiny little needles on the tips there, and this is our more aggressive treatment setting.
Yeah, I asked 0.5 millimeter, 1 millimeter. We thought, let's do this.
What'd you go for?
1 millimeter.
So Dr. Portella, you were saying that there may be a little bit of bleeding, possibly.
Yeah, so
This
we are
is
going
perfect.
deep enough to get some of those superficial blood vessels that sit right underneath the skin. And so it looks alarming sometimes, but it's completely normal, and it doesn't cause any problems with the healing. So we're just making sure we've got all the soap off the face, and making sure that we have decreased risk of any infection. I know the cheeks are the area you wanted to focus on. Is it still feeling pretty numb as we get everything off of there?
Yes, very numb.
Okay, so we're going to start here on your right side, and we're going to use the serum on the skin. We'll start here on the medial part of the cheek. This is what the machine sounds like. So it is a little bit loud. So we'll start on the lower treatment setting, and then you let me know how you're tolerating it, okay?
Yeah, that hurts, Dad. Oh, that hurts. That was the deepest.
That was the deepest.
Did it bleed?
Not bad. It didn't bleed very bad. Totally fine, man.
Okay, we're good.
Good stuff.
I'm crying.
It's okay. You got this, sis.
So after we create those injuries in the skin, then we want to put that serum back on there so it gets down in those channels.
Mm-hmm. Can you do like half on my forehead? I know that's torture up there.
Yeah, we'll keep it on the lower speed.
You're doing awesome. Good thing we have big cheeks.
Beach in Hawaii.
We're going to keep moving up. Doing okay?
Mm-hmm.
Doing awesome. So tell me again what that little roller thing does, like what's in it?
So it's a proprietary formula from ProCell that is stimulating the body's own growth factors to be released, so that as we create the injuries in the skin, we get a better healing response of healthy collagen to fill in those acne scars and limit the pore size.
Feels like razors on my face. Good, good, good. It's good though. Just gotta remember to breathe. Mandy, what do you think? Do it.
All right, we'll do the chin now, and then we'll get the upper lip and then the nose.
Okay. The nose hurt pretty good.
It can. and we're going to give you the rest of the serum to take home. And by the time you get home, then you're going to use the rest of this and cover your whole face once more. So you take that home. That's the only thing that will go on your skin tonight. And then tomorrow morning, I want you to wash with just water, and then you're going to start the step 1 and step 2 serums that we talked about.
Okay.
And that's going to be your routine for the next week. No other acne treatment creams or anything else, prescription or otherwise. Just use the serums to maximize your results.
1 week, okay.
Okay, how long should she wait to put on makeup?
Ideally, we would like 48 hours, and then keep it very light, just to, you know, while you have those channels open, we don't want things going down into the skin that aren't designed to be down there. And that's why we like just good washes with only water, and then the serums. Those channels are all going to close up over the next 12 hours or so. And so if you can give it a couple of days, it's ideal, but within a couple of days, light makeup is fine.
Okay, awesome. Well, thank you.
Yeah, thank you.
Okay, good. Okay, so it has been 14 days, 2 weeks since I got the microneedling done. And it was as bad as it hurt, you guys. I would 100% recommend it. Like I said, the first day it felt just like a really bad sunburn. That night it was really painful. The next day I went to go put on that Procel stuff, and it just felt like it inflamed it even more. And up until like day 3, I was seeing like really big pores, like bigger than I've ever seen. And so I was like, oh no, what did I do? To be honest, I was kind of like, I don't know if I'd recommend this. I was kind of nervous about it. But you guys, after day 3, it just kind of started turning better. And now that it's been 14 days, 2 weeks, Dr. Portella was right. That's kind of when you're going to get that the full effect of what had happened. So I'm just gonna go ahead and turn my light up a little bit here and really get close and let you guys see. He did mention that 3 treatments is recommended. So I have had 2, one with him and one with a friend before. And anyway, so there you have it. I can already tell like my makeup applies better. They always say a clean canvas is the best for the makeup to look good, and so that's what we're working on here. But super impressed. Dr. Portella, thank you. Super professional. Everything was just as he had explained, and I'm happy I did it. So anyway, thank you guys for watching. Big thumbs up. Be sure to comment. Let us know your thoughts, or if you guys want more information. We'd love to chat with you. Thanks.